And it's really important for us to kind of hit home on that with some people. We're not just trying to help you at work. We're trying to help you at home too. We're trying to help you be able to run with your kids at 70. We're trying to be able to help you go home and not be in pain so you can spend more valuable time doing your hobbies and things that you love. And so when you kind of make that
Welcome back to the Briotix Health Spotlight. Injury prevention in the workplace is complicated, but it's essential. An analysis on costs and savings associated with workplace wellness programs found that medical costs fall by about $3.27 for every dollar spent on wellness programs, and that absenteeism costs fall by about $2.73. An ounce of prevention is really worth a pound of cure. Christina Twine is a team manager here at Briotix Health who has seen the full course of injury prevention and joins us today to tell us what that looks like in the workplace and some of the secret tips to its implementation. Hey, Christina, thanks so much for hopping on with me today. Could you tell us a little bit about what you do and your history with Briotix Health?
For sure. So currently I'm in a team manager role. So really I have a lot of oversight over supervisors as well as industrial sports medicine professionals. But I started off with this company really as a part-time provider at one of our clients. I only had 4 hours and it was my second job in this setting. So I had a little bit of a sense of what it was like, but I knew I really liked it. I wanted to stay long-term and I really wanted to work with Briotix Health. So I started off part-time at a client, fell in love with it and was able to grow into a larger role where I was able to do more mentorship to other industrial sports medicine professionals and also just grow in my own skills and knowledge of what injury prevention looks like, what variety of solutions we can offer, how that varies from client to client. There's really a wide breadth of what we can do. And so the more I've been in this company, it's been about 8 years now, the more I've just diversified my view on what injury prevention looks like and what we can do as a company. So I'm really passionate about it. I love doing this. I love mentoring others and I love helping supervisors lead their teams to success. And so that's the role that I'm in currently.
So you obviously have a very extensive background in not only supervisory positions here, but also in the field of working as an ISMP itself. So with that background of seeing both sides of being the person implementing the solutions and seeing the oversight of getting those solutions into the workplace, what does an injury prevention solution look like in the workplace? Is it just, doing stretches here and there, throwing some cold packs on when someone gets injured? What does that process look like, and what does it look like in the workplace applied?
For sure. There's really two tracks that I like to think about this. There's really a proactive approach and a reactive approach, and we try to hit both aspects. The proactive portion of injury prevention is really getting ahead of injuries that could happen. So it could be evaluating certain tasks and doing different job coaching or best practices to make that task safer. It could be doing a health and wellness initiative throughout the company so that people have higher morale and understand their body and how to talk about it more. It could also just be very specific to what a client needs, right? A manager or a client notices a trend and they want to work with us on a solution to make sure that doesn't get worse, or they could potentially have something coming. They know a new task is coming or they're going to change the way that they can do things. How can we get ahead of it to make it safer and prevent injuries from happening in the future? So that's really a proactive approach. The reactive approach is really looking at, okay, there's been a trend in this department. There's 10 different people who got hurt doing this task. Is it the people who maybe need coaching and don't know how to do it safely, or is it the way the task is being done? And how can we reactively look back and prevent this from happening again? So there's really lots of ways to look at it, and it's very specific to the client, to the task, even down to the person. You can look at it from a task level where we are potentially looking at the task, or from a people level, right? Did we train them well? Are they doing this ergonomically correct? Is there something that's going on outside of work that's affecting them at work? There's so many ways to look at it. And really, as an industrial sports medicine professional, you're kind of like an Inspector Gadget. You're trying to figure out where these little holes are that you can insert yourself and make the workplace better and safer for everybody there. So there's so many aspects that can tie into it, and it ebbs and flows and changes depending on what's going on. But that's kind of the fun of it. It's never the same. And you're really on a team approach with the employees, the management, the location, the client, just trying to figure out what's going to be the best solution for that specific client and that specific person. So I really enjoy it. It's really fun. Prevention is it's a very broad term. And it can really be viewed in so many ways, but that's why I think we do a really good job, because we hit it from so many different angles and trying to make sure that we are putting our best foot forward and providing the best solutions for our clients.
Yeah, when you're going into a workplace and you're trying to start to implement these solutions, what are some of those knowledge bits, that education that you bring in to show the importance of this? Obviously, we can always bring in the numbers, the cost savings that you can see, on the spreadsheet. Here's what happens when you implement these kind of solutions. But what are those kind of day-to-day things you're saying to the workers of, hey, this really does help you. And it's not just numbers, it's, well-being beyond that. It's your wellness, it's your health. What are those educational bits that you bring into the workplace?
Absolutely. I think sometimes when you go to work, you start to compartmentalize your work life and your home life, but in reality, one affects the other. If there's things going on at home, if you are an avid basketball player on the weekends and you're not stretching, that's probably going to affect you at work when you're doing manual tasks. Just like if you're at work and you're doing something that causes an injury, it could potentially affect you at home when you're trying to, be with your family and play with your kids. So they really are in tandem. And it's really important for us to kind of hit home on that with some people. We're not just trying to help you at work. We're trying to help you at home too. We're trying to help you be able to run with your kids at 70. We're trying to be able to help you go home and not be in pain so you can spend more valuable time doing your hobbies and things that you love. And so when you kind of make that parallel, that the two kind of work together, hopefully it hits home that yes, there's numbers behind this. Of course, there's a reason why we want you to be safe. Of course, there's potentially a cost savings or you don't have to be out of work, but also this should help you in the long run with your entire health and well-being and help you just to be a healthier, happier person overall. So those are just some personal points that I like to hit on when I'm talking to individuals. But I think it also goes to the workplace environment as well, and having high morale and making sure that people, come and they're enjoying their workplace. And, mental health, behavioral health is so important. And an injury can 100% affect your mental health and your behavioral health. And just getting ahead of all of those things and showcasing that we're not just trying to help you stretch, we're trying to help you in all these other aspects of life. And this is just one little piece of that. And that's, again, why I think we are such a good company, because we hit it from all angles. We understand that people are people. Things are going to happen, whether it's at work or at home. And we just want to make sure that holistically we're looking at all of it and trying to make sure that that person is getting what they need.
In the workplace today, improving morale is essential. In a study of 1.6 million workers by the Harvard Business Review, they found that the companies that were making real gains in retention and worker happiness scored markedly higher than others in 5 specific domains: support from and confidence in senior leadership, recognition of the contribution of employees, respect and involvement in decision-making, manageable job stress, and adequate staffing. When it comes to injury prevention, establishing those tenets of good morale and maintaining trust, respect, and understanding are key. Safety is a culture that has to be developed and built for success. A safety manager's job is massive, and creating an injury prevention solution from the ground up can seem next to impossible. When something you mentioned in there was the culture, the kind of, the establishment of, getting people into that culture of wellness. When you're approaching it from the management angle, of course, we see that individual approach from the worker of, relating it to them and their life. When you're going in from the management approach and trying to get the management on board, trying to get people in and excited about, getting healthier workers, what's your approach there?
Yeah, it's kind of the same thing, right? Of course, there's numbers behind it, and there's things that we bring to the table from a client perspective to show the value of our program and to show that we are able to potentially fill a gap that might not have been filled if we were there. One big thing is we could take things off of a client's plate, right? Maybe they didn't have an injury prevention specialist, and there's all of these things that they're doing outside of injury prevention, and now they have something on top of that when someone gets hurt, they have to do. We can take that pressure away. We can be a sounding board. We can be someone to bring solutions and help so that the management can focus on, things that are important to the client or that are important to them. And we can take that on and really, again, work in tandem with them to make sure that we're helping them meet their needs. So of course, there's numbers behind it. There are statistics that show that when we are there, we can help lower injuries. We can help lower costs. We can help keep people at work. But we can also just take things off of your plate and, give you solutions, present things to you so you don't have to think through that. Really individualize our services to you to keep your workers more productive, to keep them happier and not wanting to leave, to, again, influence the culture of your warehouse or of your location and make it more of a safety culture that's positive, we can affect all of those angles while also helping to reduce costs and helping to keep people at work. And so that's kind of a way that we can hit on it on from all angles, right? Especially from a management perspective. I do see a lot of numbers and a lot of goals and things that we have, and we want to be proactive in helping every client meet their goals on all levels, right? So if we can influence it in some way, we want to help. Every client is specific. It could be reducing injuries. It could be a certain amount of safety initiatives. It could be a certain amount of pre-screens. We want to help with that. And as soon as we know what the needs are of a location, we can not only meet those needs, but present potentially new solutions that might not have been thought of if we weren't there. And so I think the innovation that we bring from a client perspective and a management perspective is amazing. And it's just something that you might not get if you don't have an industrial sports medicine professional there, or if you don't have a company like ours in the background trying to help find solutions for you.
That aspect of taking something off their plate, I think, is such a great way to approach it because there really is so much involved in injury prevention. The solutions, the enacting, the results afterwards, the analysis that has to occur, and putting all of that into one package, I think, is something our ISMPs, our managers, our supervisors all do so well. Christina, thank you so much for hopping on with me today. It was really a pleasure hearing about your background in this, hearing, that experience you have really succinctly put, was so great. And I really think that's going to be so useful.
Thank you, Matthew. It was great talking to you.